Frozen shoulder, also known as adhesive capsulitis, is a condition characterized by stiffness and pain in your shoulder joint. Hi everyone, I'm the senior orthopedic physiotherapist. I'm going to show you few exercises for frozen shoulder. The signs and symptoms typically begin gradually, worsen over time and then resolve, usually within 1 to 3 years. Treatment of frozen shoulder involves range of motion exercises and stretching exercises. Sometimes corticosteroids injection into the joint capsule also required. Frozen shoulder typically develops slowly and in 3 stages. Each stage can last a number of months. First stage will be freezing stage. Any movement of the shoulder causes pain and your shoulder's range of motion starts to become limited. The second stage is frozen stage. Pain may begin to diminish during this stage. However, your shoulder becomes stiffer and using it becomes more difficult. Your range of motion will be completely restricted. And the last stage will be thawing stage. The range of motion in your shoulder begins to improve. For some people, the pain worsens at night, sometimes disruption of sleep. The risk factors, certain risk factors may increase your risk of developing frozen shoulder. One is age and sex. People 40 and older, particularly women, are more likely to have frozen shoulder. Second, immobility or reduced mobility. People who have had prolonged immobility or reduced mobility of the shoulder are at higher risk of developing frozen shoulder. Immobility may be the result of many factors, including some injury in the shoulder joint or rotator cuff injury, broken arm, stroke, or recovery from any surgery, shoulder surgery. So I'm going to show you some exercises for frozen shoulder. It will be just normal stretching and range of motion exercises. So first few exercises will be with a stick. I'm going to take this is a chapati maker, so you can take any kind of stick. You have to hold it. Suppose I have a frozen shoulder in my right side, so you have to hold with both hands and then move it forward. So this is called forward flexion movement. Move slowly with the help of the other hand, how much it can go. When you have frozen shoulder, you won't be able to move maybe more than 90 degree or more than 110. That is fine. So how much it can move? You can move, go up and down with the help of the other hand. It's better if you can do these exercises in front of a mirror. So that is, we call that as biofeedback. So you will know like how much your hand is moving up. Second exercise with this stick will be sideways. That is for the abduction. So my right side is affected. With the left hand, I'm pushing the right hand and moving it up. You may go until this in pain-free motion. After that, maybe it will be a lot of pain, but you try to push your right hand with the left hand and go up how much it can go. And then while coming down, you have to pull down that hand. So this is also called active assisted exercise. You are doing it actively, but this other hand is giving you assistance. So this was the abduction of the shoulder. The third stick exercise will be for the extension. Extension is this movement. This movement will be painful. For that, You have to hold the stick like this and try to move it backwards. How much it can go, and come back. All these exercises try to repeat 10 times. So the next exercises will be for the capsule of the joint. We have to stretch the capsules. This frozen shoulder, also called as adhesive capsulitis, because the capsules will become very tight and which will cause this pain. So to stretch the capsules, first I'm going to show how to stretch the posterior capsule. To stretch the posterior capsule, you have to, my right hand is affected arm, so I have to move this right hand here, and with the left hand I have to push it. I'm pushing my right hand with the left hand, so I feel stretch in this part. I am stretching the posterior capsule, and you have to hold your hand in this stretching position for 10 seconds. You have to count 1 to 10. The next capsular stretching will be for the anterior capsule. So to stretch the anterior capsule, you have to get some wall. So in front of the wall, your right hand, the affected hand, will go here like this, and you have to move forward so that you will feel some stretch here, and you need to hold for 10 seconds, 1 to 10. I am feeling some stretch in my anterior capsule. Next exercise will be pendular movement of the shoulder. For this, you can do it with some weight or without some weight, but if you do it with some weight, it's better, because weight will open, if you hold the weight, it will open up your shoulder joint. So I'm taking, you can take a book, you can take a water bottle, anything, but don't take any weight more than 1 kg. So I'm taking a book here. First, you need to just bend a little bit, and then just move your hand. Actually, you are not supposed to move your hand. You should move your body, and you leave your hand just relaxed so that your hand will move in anti-clockwise and clockwise movement. So clockwise and anti-clockwise movement 10 times you have to repeat. Also, you can do forward and backwards. So you are moving your body so that your hand is moving. So this is called pendular movement and forward backward movement. The last exercise for this video will be wall sliding. For that, you need to take a towel, a small towel or a piece of cloth, and you have to keep it on the wall. So that, and then the affected arm you have to hold, and your body will be. So you need to move this hand upwards. Don't put much pressure to your shoulder, just move along with your body. So your body is pushing your shoulder forward. Go up how much you can go, and then while coming down, move your body backwards and move your hand down. This is called wall sliding. This exercise you can do facing the wall. So that will be forward flexion like this, and you can do sideways. Sideways will be abduction. So when you are moving up, your body will go towards the wall and you will move your hand up, and while coming down, your body will go away from the wall and you need to move down completely. These are the basic exercises for first stage of frozen shoulder. When you have the first stage, then you can start this stretching and range of motion exercises. In my next video, I will give you exercises for second and third stage of frozen shoulder. Hope you liked my video. If you liked it, please don't forget to share and subscribe to my channel, Get Well Physiotherapy. I will see you in my next video. Have a nice day. Bye-bye.